if we now move to Kat Boettge, if you're happy just to have a brief introduction about the work that you do, some of your background in working with mental health, and essentially as a discussion point, how we can then make changes and move forward and come together as a community of women, either through social media or through activism, and how we can effectively help other women and other people within the party as well as the wider population. Thank you, Kat.
So I've got a degree in psychology and a master's in psychotherapy, integrative psychotherapy. So I've been working within mental health for about now 17, 18 years. Currently, I've got a private practice, small one, mainly students, but mainly I work for the NHS as one of the NHS services. So we offer short-term counselling or CBT therapy. Now, if you're not a CBT therapist, everything's called counselling in the NHS currently. But as I said, I'm an integrative psychotherapist. So at the moment, we are all working from home like GPs, because although we count as frontline workers, we are lucky in the sense that we can still do the work via video or telephone consultations. So we offer patients or clients about 6 sessions. It's not a lot, but it is what it is. It's a primary care counselling service in the short term. Now, and I've been doing for the NHS the work for quite some time now, and I'm a supervisor as well. Now, I think what is really important is our mental health are all immensely affected by this crisis in various ways. So I tell patients all the time, we expect families stuck together, emotions are running high, conflict will occur. And anger and difficult emotions are completely normal and okay. Of course, behavior that can come from it can vary. So aggression, for example, or violence is, of course, not okay. Then we see also the other side, people who are completely isolated and living on their own, and they're struggling with loneliness a lot. Now, I keep saying I'm quite glad that this is happening while we've got social media, although social media, it can be also and cause some problems, but it is a good way how we can reach out. People are feeling the anxiety, and I can see it even social media. Some people turn that, unfortunately, into aggression or anger very quickly. And it's about recognizing that, as I said, emotions are normal. There's nothing to be frightened of. We don't even talk about good or bad emotions, because emotions are just emotions. And it's important that we can talk about it and reach out and help one another, because there's loneliness, even when you're stuck with your family, you can feel still quite alone. It's quite frightening. And the anxiety and fears, what's this crisis going to do to our loved ones or to the world, is really an issue. Now, coming to women, I think women are particularly affected, because not only tend they usually do the domestic chores and the childcare. Now they've got homeschooling on top of it, but they're also stuck with their partners, which who were able before, we were able to at work to have a rant with a colleague, to have a break from one another. Now we're all very condensed at home, and the stories I'm hearing are quite frightening. I've got some patients who literally split up during this lockdown. Sorry, I'm just going to get my coffee in. So, and they're literally with their partners stuck at home, not being able to manage. Yeah, I mean, can you imagine splitting up with somebody and then not being able to move out? Is terrifying. Also, the domestic violence, and it's gone through the roof, and I'm hearing it. As I said, emotions are normal and fine, but the behavior that can come from it can be wrong, yeah? And aggression is, of course, always wrong. Violence is wrong. Abuse is wrong. And women, sadly, still getting the most of it. Of course, it can happen the other way around, or it can happen in same-sex relationships, but it tends to be women who suffer, and suffer in silence. So we need to support one another, reach out, particularly in Green Party women. This is a community where I think it'll be very useful that we have these conversations as we're having now, and we can offer support to one another, because being left alone in this situation can be so isolating and actually really, really dangerous.
So what are some of the practical measures that, first of all, if women or anyone at home is experiencing this kind of domestic violence, what are some of the first points of contact that they can actually do, assuming that the police and so the normal contact lines are still open? But it would be useful to find out how that's actually being impeded by the COVID crisis. So what would, in that situation, happen?
Well, there are various things that you can do. First of all, let's talk about mental health aspect before I talk about the violence. You know, if somebody is struggling with their mental health and doesn't know what to do, call 111. Although I'm not a fan of them, I have to say personally, but call 111 if somebody has done something or is really not able to stay safe. Of course, call the ambulance service. Then contact your local NHS provider and see if counselling or CBT is available for you. It varies from local authorities to local authorities. However, we still are working, so you can still have that support. And at the moment, our waiting list is actually really, really short, because I think a lot of people don't think we're still open. Yeah, but we are getting ready to also support frontline staff, as well as, you know, getting ready for this crisis and mental health wise to really offer our support. And my colleagues have been absolutely fantastic, I must say. Now, in regards to domestic violence, I've actually had a few cases just this week where they did contact the police, and the police acted very, very promptly. Nonetheless, I was quite impressed. But this is just my anecdotal experience. That might vary as well, depending on the area. But please feel free to contact the police if your safety is at risk or if you need to report a partner. And then, of course, there are various charities helping with domestic violence. A very good one is, of course, I mean, I don't know each area, but here in Nottingham, we've got the Women's Centre, who are excellent. Yeah. And they offer also counselling and all sorts of support and advice now over the phone, of course. So please feel free. It's really important, because a lot of the people say, I didn't want to bother anybody. I didn't know if my case is severe enough. I know there are worse people off than me. And that's not true. Every person counts. Every woman counts. And we need to ask for support if we require. And it's better to do a telephone call and then nothing comes from it than not doing so, because literally people's lives depend on it. And if somebody becomes violent, yeah, and it might have just been a one-off, no, it might not. And it might actually kill someone. So also, if you know of somebody else who is in an abusive relationship, please reach out to them, give them the support and advice, and make them feel valid. Because the most damaging thing is that people don't think they're important enough, or that their case is not severe enough. And actually, we're talking here, this can be dangerous, not just to our mental health, but also as a physical health and safety. And to the kids. I mean, a lot of the kids are witnessing now conflict much more than they would do otherwise. And it's important that we think about their mental health as well. So we need to reach out.
How is the best mechanism to reach out? Obviously, we have social media, but there's also a sensitivity about bringing up those kind of questions. Do you have any sort of tactical suggestions on how to raise that issue without perhaps being so overt that you make someone else feel uncomfortable?
Just show that you are there to listen. Don't feel that you're judging anyone, neither, you know, even the partner, because a lot of the time people don't say anything because they want to protect the partner from family, for example, not liking them and stuff. So if you show a non-judgmental, open way that you are there to support, not to judge, but you're there to support, but still allow that person to have the choice, unless it is a real emergency. And that is usually just say, I'm here for you. I'm going to listen. And then when they do share something, you can say, look, there is support, we can do this, but it's entirely up to you. Unless, of course, we're talking here about a real risk, and also towards the children we need to consider, because it is also a child protection issue if there's domestic violence happening in the family. But foremost, you always try to encourage a person to make that choice themselves by being non-judgmental and supportive.
Do we have any questions from our members on this particular issue? Carla, could you lower your hand, because I believe you've commented in the actual chat now. Thank you. Louise Radis, could you unmute Louise's mic, please?
I was wondering, question to Kat, are you aware that Oliver James, psychologist and writer, he's got a very low opinion of CBT. In his book called Not in Your Genes, he says it's basically a quick fix. It's most unfortunate. It's used as the one-size-fits-all treatment in NHS psychotherapies.
I do have an...
So I know I'm on the autism spectrum, and my medical note said about me does not respond to CBT, but apparently there's nothing more that can be offered.
Well, I'm sorry to hear that, but yes, I've got a strong opinion about CBT. I think it's got its uses. I use it as strategies, not as a therapeutic approach. As I said earlier, I'm an integrative psychotherapist, so I'm basically humanistic, but I integrate different aspects. Now, I don't think very highly of CBT, I must say. I think it is a quick fit. It has its place, it can be useful, but I think only as part of an integrative approach, because empathy in the relationship is actually the most important aspect of the healing, and all research has shown this. CBT works in the short term and works for specific conditions, but it doesn't work for all. And the amount of people I get through say, I don't want any CBT anymore, it's not worked, or it's not worked for long term. Yeah. Unfortunately, at the moment, we're still in a time where the NHS has been favouring CBT just simply because of the lobbying that has been put in. But I think this is about to change soon.
Could you briefly explain what you mean by the lobbying?
Well, when it all started, what we call IEP services, which are primary care psychological treatment, yeah, the CBT therapists, or the lobby, the associating body, was very quick in producing the NHS with research showing that it's got good results, which it has, but it's only short-term research being done. And now the humanistic therapists are starting to do the same about 14 years later. So CBT has been favoured just simply because they lobbied the NHS and the government and saying that they're more effective.
Thank you. Does anyone have any suggestions about anything that we could do collectively as Green Party women to raise awareness of this? Obviously, we've already got the video that was done 2 weeks ago with Karen Ingala Smith talking about the Counting Dead Women project and the femicide census. Do we have any further points on how we can actually work as a community on this?
Hello, I'm Sally. I'm from Worcester Green Party. Can you hear me?
Yes.
I think I am the social media officer. I'm not entirely sure. I've just been kind of kicked out in a weird way. We had Facebook groups, and I had no idea about Green Party women until I saw a Facebook post on the page itself. But in my time as the social media officer, I was heavy on the getting women together. And if I'd known about this, then I absolutely would have been just pushing it really hard and just making people aware that it's there and that you have to opt in. So maybe if the social media officers were told about this and the importance, because if they're men and not interested, not all of some of them are all right, yeah, then they might not understand that it's not just a matter of if you build it they will come. So I think that through the social media effort there, we can get loads and loads of people involved. And for the people who aren't on social media, like, I'm friends with a Green Party member who's in her 70s, and she is on social media, but some people in that age group aren't, and I could tell her about that, you know, if she weren't on social media. So
yes,
I made the same point 15 times. Sorry about that.
I think that's also reiterated in the comment I've just seen in the sidebar, which is from Mariette, which says, should we, in a practical way within our local parties, list services available within our communities for people living with domestic conflict? I think that's a very good idea. Mariette, would you be happy to take the lead on that, since you posted the issue? Hello, Kate. So moving on from the issue of domestic violence and other issues sort of concerning women, could you give a brief introduction to yourself and the organisation that you work for, and why we've asked you here today?
Yeah, sure. Thanks very much for inviting me, and apologies if there's a bit of background noise. I have some irritating children, my own children I might add, that are playing netball in the garden, so I've asked them to keep quiet, but I'm not sure how much they'll honour my wishes. Just to say that Women in Prison, for those of you that don't know, provide services for women in prison and those at risk of offending through women's centres and also in the prisons. But we also campaign for a significant reduction in the use of prison for women, and also the rights of women in prison and affected by the criminal justice system. And I've been asked to speak today about a particular campaign around COVID-19 and a campaign to significantly reduce the number of people, women, men and children held in detention through prison and other detention sources, i.e. youth offending and for reasons of refugee status.
And for people who missed the beginning of the call, I'm just going to draw their attention to, there was an updated amendment that was posted. Apologies, this was due to a technical issue regarding email and getting the information proofed. So we have posted that as the Green Party Women online schedule number 2, and that contains the updated information, which also contains the updated links that were referred to by Kate. Sorry, just to flag that up. So thank you, Kate, if you can continue.
Thanks, Dawn. So I was just going to speak for a few minutes about what the issues are and what our campaign is, and then for a couple of more minutes about what I think that you as a group might be able to do to support us if you were able to. So, I mean, for those of you that don't know, there are about 3,600-700 women in prison, usually at any one time, and that's about 5% of the total prison population. The vast majority of women in prison are there on sentences that are quite short for low-level non-violent offending and don't present a risk to anyone. Often those are theft, so shoplifting is still a very common reason why women are sentenced to prison. Others are there on remand. Again, they don't always receive custodial sentences, and that is no different during COVID-19. What we've been campaigning for is that because prisons present such a risk in terms of spread of the disease, because of the fact they're overcrowded, because of the nature of imprisonment and the difficulties of self-isolation, the fact is that the prison service has responded by creating a new regime, which means usually around 22, 23 hours in cells, which will go on for the period that it needs to in terms of preventing risk of spreading the infection. For us, this means that for women, there are major issues, not just around the disease itself, but mental health and well-being, ability to stay in touch with family, friends, and particularly children, and a massive issue in terms of their own mental and physical health. So from our point of view, the campaign that we've had is to prevent spread through reducing the prison population, and for early release and for stopping the use of imprisonment, particularly on short sentences, by sentence of the court. The response has been extremely disappointing despite weeks of campaigning since all of this started, and this includes a campaign to secure the release of pregnant women in prison and those on mother and baby units with their babies in several of the prisons across England. The government has in principle agreed that that should happen, but it hasn't been happening quickly enough. So it's been very slow progress. And I think the latest update was 17 of the pregnant women, which there are difficulties in terms of securing exact numbers, but that would be probably around half of the women that are pregnant in prison at the moment. So from our point of view, what we would like from a group like this is support for our campaign to secure the release of those from prison who do not present a risk to the public, and also to argue for more resources in communities to support those who are leaving prison so that they can be supported during this lockdown period. And some of the things that we're doing with partner women's centres, and I know some of you here already support your local women's centres. We run a women's centre in Manchester, in Lambeth and in Surrey, in Woking. And the work that we're doing is around supporting women who are leaving prison to make sure they have access to key work support by phone and by electronic means, and that we're able to support them in tackling the root causes of offending and preventing re-offending through community support rather than through their prison sentence. So 2 specific things you could do for us is to follow our campaign with Inquest and Birth Companions and other charities like Women for Refugee Women, who are also campaigning for women in Yarl's Wood to be released, and to support those calls to contact your MP and other things of that nature, but also to support our general campaign. And I know again that some of you have already supported us. I know it's hard on the camera, but the Open Up campaign is to open up supports for women's futures through supporting resources such as women's centres in the community, which receive a woeful level of funding from government at the moment, and there is not a clear commitment from government to support those kind of community-based resources for women who face multiple disadvantages and multiple needs. So that's me, Dawn. I'm happy to take questions if anyone has any.
Can I just briefly ask a question for you to explain the difference between what is a custodial and a non-custodial sentence, because people might not be aware?
So a custodial sentence is a sentence of imprisonment. So that means that you're sent to prison for the period of your sentence that the court deems is suitable given the offence that you've committed. And a non-custodial sentence is a community sentence, which often involves, it can involve things like electronic monitoring, community work, and also tackling root causes of offending through various means, whether that be accessing mental health services, substance misuse and so on. And a non-custodial sentence is supervised by the probation service, and often services like ours also provide support in addition to that in order to help women to access the support they need to actually address the reasons why they're often brought into the criminal justice in the first place, which are often mental ill health, poverty, substance misuse and so on.
I'm seeing a hand up from Judy. Is that Judy? Oh, yes, Judy.
Hi, hello. I'm unmuted now, I think, aren't I? Yes.
Yes.
Thank you. It's tragic, isn't it? And thank you for that sort of briefing on how tragic it is. I hear you asked us, you know, for the Green Party to support your campaign. I was just sort of thinking about how we can do that, and I would think in the first place, I'm not quite sure who our spokesperson is on women's issues. I think it might be Amelia, actually. I'm looking at Sian there. Is Sian sort of, maybe Sian isn't sure either. I think it's a sort of thing, though, that we know. I think it's something that we should be able to do publicly. I don't have, I think it's something that Green Party women could propose for you know, a statement at the time. Is very topical and not something that we should delay on. But that, I just throw that in. I think it is something that we should be able to support in you know, in the short time that we have for these sorts of things to get into the press and to have an impact.
Yes, so if anyone wants to get involved in that campaign, obviously we're looking for expressions of interest at this stage. It's not a legal commitment, it's just trying to get people who can organise or are interested in working together as part of a sort of a focused group on this particular issue, and to make sure that we are organised and that we actually have some kind of strategic objectives. We're planning on doing that through the Slack, and like I say, we will do a separate channel on this as a particular campaign. So if people can, in the chat on the side of this Zoom call, flag up any interest that they have, any suggestions that they have, or any potential ways of working in terms of other links to organisations that they might have, not necessarily links to other organisations regarding women's in prison, but in certainly women's organisations and networks that we can tap into in order to get the word out and to get the information out on this particular issue. Do we have any other questions for Kate on this issue of women's in prison? Oh, sorry, Frida, yes.
Yes, I was wondering, Kate, if you can say anything about there's a group of women's centres that are setting up facilities to actually take women who are in custody as an alternative custody. You'll know about that, I think. Brighton's one of them, I think.
Yeah, so we work really closely, increasingly over COVID-19, with women's centres across the country, and there are women's centres in many areas that provide support to those leaving prison and those on community sentences. And Brighton Women's Centre is a very close partner of ours, and Lisa Dando works closely with me on all of these issues. But what we would really like is Green Party Women to increase those links with women's centres, because we're increasingly becoming more politically active. So we provide services on the ground, but there is an increasing desire for women's centres to become more politically active in calling for the sort of support across the country that we provide in pockets at the moment. So thanks, Frida, for highlighting that. It's a really important part of our work.
Yeah, I was chair of Coldale and Kirklees Women's Centre for many years, when we set up the women in prison, you know, the links and working with women in prison.
Yeah.
Unfortunately, I died from that when I started being active in the Green Party.
Unfortunately, all the changes around probation that have happened in the last few years under the Conservative Party in terms of privatisation have had a massive impact on the ability we have to access funding, and also to access referral pathways so that women get referred into services like ours. So it's something we're hoping will change in the months to come.
Yes, our local women's centre had to give up on the project to support women in prison, because the work we were doing with probation was privatised essentially and became impossible to work with.
Yeah, women in prison were in a similar position to Calderdale.
But I think the time's right, really, to have a campaign to develop women's centres everywhere. I think they should be funded properly through local authorities. Our centre has about 40 different funding streams of all kinds, but still struggles every year. So
I'll take Stella and then Julia Erskine, who is under Richard Erskine.
Hi there. Our local rape crisis centre, it has been so underfunded that I called them in the early autumn, and they said that it was 6 months waiting list. It's 6 months in Worcester, and women's centres are really, really important. I think that the rape crisis centres could be a central part of that, because that's sometimes how women can get to deal with other issues.
Okay, thank you very much for your comment. Just going to quickly take a last comment from Julia, who's under Richard Erskine. Dee, if you can unmute Julia.
Hi everybody, can you hear me?
Yes.
Hello there, hi. I was just thinking, I don't know very much about this topic at all, but I'm just thinking about the general picture as in regard to prisons as a whole for the population, you know, men and women and kids and whatever. And thinking, I think it's quite important that when we're looking at this, we're thinking about how we can integrate the whole, how we can get away from prisons as a first course, as a first route, if you like, generally, and wondering how we can sort of encourage the government to sort of work more, you know, more helpfully for people who are just sent to prison. Do you know what I mean? Am I making any sense?
Kate, if you have a final comment for you on that?
Yeah, sure. Thanks so much for raising that issue, both of you, because firstly on Sal's point about the rape crisis centres, we work really closely with women's organisations on domestic violence and sexual abuse really closely. So the idea is that we fundraise, we raise awareness of the need for women's specialist services around all of these areas, so there isn't a divide and rule tactic. And certainly Fawcett and other women's organisations have just put a letter out last week which is about the impact of COVID-19 on women in a number of areas, including the area of domestic abuse and all those sort of issues you're covering on your session today. And the point that was just made about prisons in general, absolutely. We would love this group to be alongside us in taking an abolitionist stand.
Oh, I think we're having a technical issue with Kate there. My understanding was that her position was that we were wanting to take an abolitionist stance. I think that was the following of her sentence.